Hello and welcome everybody. And today I'm very pleased to sit down and chat with Dr. Anita Sturnham. Now, Anita is a GP specialising in dermatology, and I always love talking to GPs, so we'll come on to that in a minute. Today's chat is sponsored by Child's Farm, and a lot of you will already know Child's Farm because we promote them across our site. They are an excellent resource, I think, for particularly for children, those with skin that's prone to eczema or sensitive skin. And so we will be talking about some of their products, but in essence, our chat is really about the impact of seasonal changes on eczema-prone skin. So first of all, welcome, Anita.
Thank you so much for having me. I love the opportunity to talk about anything skin related, so I'm looking forward to it.
Before we start rattling on, and that would be me rattling on, would you like to just tell us a little bit about your background and your passion in particular for dermatology?
Yeah, so as you mentioned, I'm a general practitioner. I work in both the NHS and private sectors. For a number of reasons, I became interested in dermatology from a very early age in my medical career. I had atopic dermatitis as a child and also have rosacea, so I became very interested in understanding my own skin, and then training to specialise in dermatology through my medical career, both during my core training and then postgraduate training, has been something I've been really passionate about. Not just passionate about skin and dermatology, but also about skincare and formulating. So one of my kind of side jobs has been very much focused on looking at product development and what goes into skincare and how those ingredients can improve skin health, but also can have a negative impact on skin. So I've had about 20 years of experience combining kind of my love for dermatology with my interest in skincare formulating and looking after people's skin.
Well, so one of the first things I think that people may come in to ask you is, you know, what is eczema? How do you know that you've got eczema or it isn't something else?
Okay, so we can kind of do a little bit of a whistle-stop tour of what eczema is. So we call it a chronic inflammatory skin condition, and it's a relapsing and remitting condition. It's actually quite common. It affects up to 10% of adults and around 20% of children. So we do see a lot of it in general practice. We think that the kind of the triggers or the cause of eczema is a combination of genetic and environmental factors, which I'll go into in a bit more detail as we kind of move into the conversation. But we know that, eczema is an umbrella term. There are several subtypes of eczema, the most common one being atopic dermatitis or atopic eczema. But eczema is the same as dermatitis. They mean the same thing. That it means inflammatory skin or inflamed skin that's prone to being red, dry and itchy. And it can present as early as, your infancy, so newborn babies. That's often the first time we see atopic dermatitis presenting with, young babies with red, inflamed cheeks. But the core fundamental cause of eczema is thought to be linked to your skin barrier. And for those that come to see me in my GP clinic, they'll know my little model that I have, which I love showing. So I think educating and understanding the skin is really key. But the skin barrier is basically the top layer of the skin. It's like a protected brick wall. It's there to stop the good stuff like the water escaping, and it's there to stop the bad stuff like your chemicals, bacteria, UV rays, pollution, irritants from getting into the dermis. And when you have eczema, you're born with a weak skin barrier. We call the skin barrier, it's a little bit like a brick wall. The skin cells are the bricks, and your lipids that your skin makes are the mortar. Now, when you have eczema, you don't make enough of the lipids of the mortar. So there are gaps in between the skin cells. So eczema skin is prone to losing water readily through that barrier, and it's prone to having things getting into it that we don't want to, like bacteria and allergens. So we know that eczema, and a lot of recent studies have shown that eczema is linked to kind of an immune response to bacteria overgrowth and organism overgrowth within the skin. So it's interesting to whatever the subtype of eczema, we know this is the culprit, that weakened, deficient skin barrier.
Right, that's really interesting. And I've seen that sort of diagram many times, but it's actually quite nice to see it as a block.
Yeah, well, the skin anatomy, if you can understand where the issues are in your skin when you have conditions like eczema, it then makes sense why you're being told, okay, we want you your skin isn't making enough of that water, enough of those lipids. We want you to be replacing those lipids artificially with moisturizer. We want lots of moisturization of this layer here. We want to build and strengthen that top layer. And I think when I show parents or anyone suffering with eczema the anatomy of the skin, it makes sense then, and they're better with their treatment regime when they understand it.
Why are babies and children more prone to eczema than adults?
As I mentioned, the most common type of eczema, atopic dermatitis, often presents in kind of young babies, newborn babies in infancy. And we know that, as I mentioned, with atopic dermatitis, there is a genetic susceptibility. So that child will be born with a weak skin barrier. They won't make enough of their own moisturizing lipids, so their skin won't have a healthy brick wall to stop things escaping, like the moisture. But we also know babies have a developing barrier, whether they have eczema or not. So that's a really vulnerable stage for a child in terms of their skin maturing. Babies have skin that's prone to getting dry easily, that isn't able to hold on to heat as well as mature adult skin. So we really need to look after it carefully.
And I suppose one of the things is, at what age can you start? I mean, there are obviously a proliferal of products available over the counter or prescription, but what sort of age can you start putting products onto babies' skin?
That's a really good question. I think when I meet parents, they're often quite scared to use products on young babies because that's what they've read in the literature. But actually, my first piece of advice is if you notice your child's skin looks red, angry, and inflamed, don't try and work it out yourself. Go and see your GP or a dermatologist and get a proper diagnosis, because they can give you a clear treatment plan and prescribe you some products that you know are going to be safe to use on your child. Don't try and work it out yourself. And so we do use products on young babies to help their skin if they're going through an eczema flare. And one of the key things we do is we focus on how we wash the skin and how we moisturize the skin. And that's where we often introduce a combination of things like emollients. Now, emollients are your kind of moisturizers, and we use them in two ways. We use them as a soap substitute for your baby, but we also use them as a moisturizer after you've washed your child. And so they come in different shapes and sizes, from lotions. I'll often prescribe babies and young children something like a Dermal 500 lotion, which is very watery. It's got lots of water and not so much oil, but it absorbs really well into the skin. Or you've got your richer creams, which have less water and slightly more oil. And often with young babies, we need to use the greasier ointments. So things that have very small amounts of water, but lots of oil, lots of lipid and grease to really restore that compromised skin barrier. And so I'm actually recommending parents use these products to wash their child's skin with in the morning, to moisturize their skin with after they've washed, and do the same in the evening. And if the skin's really dry, they might need to use this up to 6 times a day, the moisturizer part of that regime. So don't be scared of products, but get some medical guidance as to the right things to be using on your child's skin.
And I know that actually, particularly with Child's Farm, because we work with them around a whole range of products, and you have that whole range of everything from a wash, a bath, and is it important to try to keep to the same range?
That's always my guidance with everything to do with skin, regardless of the age of my patient. I think skin likes simplicity and it likes consistency. What it doesn't want is you to be applying random products every day, because every time you apply something to the surface of your skin's immune cells have to work out, is this a friend or an enemy? Do I need to attack this? Or is this something I can absorb and it will be okay in my skin? So don't complicate your routine. I definitely recommend finding one range that you love and trust, trialing different products, test patching them first on your child before using them all over the body, even if they are designed for sensitive skin. And that's why I love brands like the Child's Farm range. I actually have a daughter with atopic dermatitis. She inherited it from me, sadly. And I came across Child's Farm by default, but I found a number of products in their line work really well for my daughter. And I think I'm particularly passionate about helping parents to find a routine that they can use in that maintenance stage. So with eczema or any inflammatory skin issue, there are 2 ways of treating it. We treat the flares, but we also need to make sure we maintain healthy skin in between the flares, and that's really important. Many clinical studies have shown if you do a good daily cleanse and moisturizing routine for your child, regardless of their age, they're much less likely to get eczema flares, much less likely to need steroids on a regular basis. So that maintenance phase is really important. And that's where you can bring in slightly more fun products that feel a bit nicer on the skin, that your child can look forward to using. Just like meal times, I think bath time is a really important bonding time with your child, and it's a really important time for a child to feel really safe and happy and comfortable. And that's what I particularly found nice for my daughter. And I first came across the Derma range in Child's Farm. They have 3 products: a body wash, a bubble bath, and also a moisturizer. And I was using these morning and evening, the moisturizer part for my daughter, and then every night she has a bath with the bathing products. And she enjoys them. They smell nice. They're fragrance free, but they smell nice. They don't smell really medical. They come in nice packaging. You see, they're quite fun. They look like they're quite fun to use. They have really nice textures. They absorb well into the skin. The ingredients are important. So I generally like water-based products during the maintenance phase. So look for things like aqua, deionized water. Water is one of the first ingredients on the product. And you also want humectants like glycerin. Glycerin is like a magnet for moisture that draws moisture into the skin. So whether it's a bubble bath, a body wash, or a moisturizer, glycerin is a really nice ingredient to look for. In the Derma range, you have your colloidal oatmeal and oat oil, which are anti-inflammatory, really soothing and calming for the skin as well. And they also include ingredients like vitamin E, which is also quite conditioning for the skin. So you want nice, gentle ingredients. And if you're not sure as a parent what to use, look at reviews, see what other doctors recommend for their own children. That's always a good place to start. And that's actually how that Child's Farm found me, because I had a post where I'd been using some of their products on my daughter's skin. But you also want to find a range that you're comfortable with. So test patch before you use the product. I often use behind the ear or the wrist, and apply the product and wait 48 hours and make sure there's no skin reaction before starting a new product. Look for products that are designed for children. Don't use your products on your child. And so many parents do that, which always surprises me. And look for products that are designed for that sensitive, developing, maturing skin, and generally things like hypoallergenic, dermatology tested and approved, or pediatrician tested and approved are always quite good kind of benchmarks to look for. And if your child is very sensitive, you might prefer fragrance-free products as well, as they tend to be less irritant. Although, many of the brands out there for children's products do have a little gentle fragrance, which is actually fine for most children. But again, it's about testing to see what works well for your child.
And I suppose one of the things, it would be interesting if we could talk about a maintenance routine and then obviously a flare routine, and explain what maintenance means and what flare means, because we kind of understand it. But if you're new to this, you're kind of thinking, what's going on? And is that this business of, we know that people can have eczema and they could be using a product for ages and it's all fine. And then suddenly, just out of nowhere, it just stops working and doing the trick.
So that's a really key point. And if you ever notice that you're using a routine and everything's fine, and suddenly things almost change overnight, that's where you need to be quite suspicious of a secondary skin infection. Because flares that are irritant triggered tend to come on slowly, but infections in the skin come on fast. And as I mentioned at the beginning of our conversation, when you have eczema skin, you have a weak skin barrier. Bacteria and viruses and fungus can get into the skin more readily than your healthy skin barrier. So you've always got to have a high level of suspicion. Your child went to bed fine and woke up with really red, angry skin. You probably want to take them to your GP because they might need some treatment for a skin infection. Right. If the skin has slowly been worsening, then it's more likely that there's been an irritant exposure. We know things like what you wash your clothes with, fabric conditioners, what you wash your child's skin with in the bath, what they wear to bed, the fabric of their clothes, and are you using synthetic materials? We recommend things like cotton, bamboo for pajamas and clothing, kind of that light natural fabric, and then also things like linen for bedding, because it's amazing how many times just changing the pajamas and the nighttime kind of bedding can make a big difference to the child's kind of skin health as well. What else are they being exposed to? Do you have new pets in the house? Is there a smoker in the house? These things can all be irritating for a child's skin. So kind of looking at what the potential irritants are and taking those away, really important. Let's talk about flares whilst we're on the subject of that. So you've removed the irritants, and then you want to really look at that moisturising part of the skincare routine. eczema skin is deficient in natural moisturising lipids and oils, so we need to up our moisturising game and go up a gear with the way we moisturise our child's skin. And that's important. And that's the morning and evening routine as a minimum, but often when the skin's really angry, you might need to be moisturising up to 6 times a day. During a flare, I often recommend going up to kind of the greasier emollients that you're as tolerated. You know, the older your child, they may not tolerate the really thick ointments, but I often use things like Epiderm ointment or Hydromol. These are those kind of really thick, greasy textured products that contain lots of oil or paraffin and less water, and they're really good at intensely hydrating that skin barrier. Ointments tend to have less preservatives in them, and sometimes preservatives can be quite irritating during an eczema flare. So you want to be using your moisturising emollients as a soap substitute. When your child's skin is angry, red and inflamed, it's often even uncomfortable to get into the bath. So one thing I recommend is covering your child's body with the emollient before they even get into the water. And that acts as a kind of a barrier in itself. And then you use that product to use as a soap substitute. So you massage it and wash the body with that. Make sure you're not washing with water that's too hot, and don't add other products to the bath. Keep it very simple during those flares. When you get out of the bath, pat the skin dry rather than rub. Allow it to still be a little bit damp still, and then apply the same emollient moisturiser to lock in that hydration. Because a good moisturiser will have humectant properties to draw moisture into the skin, occlusive properties to lock that moisture in, and then emollient properties, skin conditioning ingredients. So you're looking for things like glycerin, hyaluronic acid for those humectants. Occlusive, you're looking for things like shea butter, jojoba, squalane. These are really nice ingredients to look for in a moisturiser. And then your skin conditioning, your colloidal oatmeal, your oat oil, your kind of safflower or sunflower. These are quite nice ingredients to look for. Vitamin E, these are all good skin conditioning ingredients. And you repeat that moisturiser throughout the day as much as required. You want your child's skin to look hydrated. The greasier it feels as GPs, the happier we are. You know, the older the child, they tend not to tolerate those thick, greasy ointments. So that's where we try and encourage you to go for the richer creams. So they're still quite thick textured and they're still nice and moisturising, but they're tolerated better, particularly on hands, face, genital areas. But the more you use it, the better.
Can we also discuss, actually, one thing that I'm just very aware of, we haven't mentioned seasons, and I know we will get onto seasons, but is the amount that one applies? Because I think that's always, you know, I presume that most products tell you how much you're meant to put on, but I mean, how much do we read that? And also, what does it really look like? That would be really interesting.
Okay, well, this is something that's a really good question. And when I have a patient or a child whose eczema is difficult to control, I always go back to basics, and I get mum or dad to bring their products in with them, and I get them to show me their routine. So I look at what they're using, how much they're using, how they're applying it. And what I see again and again is the underuse of the emollient moisturiser. And to kind of put it into context, when you're applying your emollient, you need to be putting a generous amount, almost like you're painting the whole body. Even the areas where you haven't got the red angry skin, that skin is still weak and compromised. So you want to cover the whole body with that moisturiser. And so it almost looks like you're colouring in your child's skin. You don't want to see any skin. That's how much you want to apply. And to give you a general rule, this is a 500 ml emollient product. And if you're using this for a kind of a baby or a younger child, you're going to be using this to wash with and to moisturise with. And you should probably be getting through that much in about a week during a flare. Okay, so most people are making this last a couple of months. So people are not using enough. And it's important that if you're prescribed products from your doctor, you make sure they've given you enough. So you probably want 4 of these for a month, not 1. And making sure you're colouring in your child's skin so you don't see any normal skin until you then massage the product in. We always recommend massaging in a downward motion. Don't rub, don't create friction, and move in the direction of your hair growth so you don't create any kind of irritation or risk kind of clogging your pores.
And obviously, it's not worth saving back or holding back on the amount you put in, because especially within a flare, I mean, and I know that we are discussing really in a flare, that's when you should be really going for it, because the amount of, you know, the impact of sleep for you and your child, and also getting the skin as quickly as possible under control again.
You mentioned a key point there. I always say to people, when you see the earliest signs of inflammation, act quickly. Don't monitor it and keep an eye on it. The quicker you start upping your treatment plan, as in using richer, thicker emollients more frequently, the less likely you are to need steroids or ongoing treatment. And that's another point. You can't overdose on the emollient. The more, the better. As much as you need to keep your skin having that nice sheen where it's hydrated and it feels like it's not dry. But the only thing we do recommend dosing are the steroids. So that's one part of flare management we've not mentioned. And I often find this is one area of managing eczema that parents are quite scared of, because there's lots of kind of articles about skin thinning and causing stretch marks and all these things. Steroids are very, very safe. We have many, many years of safety data, but the key is to use the steroid as prescribed and to follow your doctor's guidance. Now, pharmacies have to, from a legal point of view, put on the label, apply thinly, sparingly, and discontinue after 14 days. But I always tell my patients to ignore that, and you use the steroid for as long as you need to get good control of your skin condition. And generally, we talk about fingertip units when we are prescribing steroids. So I'm just going to demonstrate one fingertip unit is enough to cover the size of 2 adult hands on your child. So we often kind of talk about using fingertip units to dose the steroid over your child's skin, and you use it every day in the evening night routine for at least 14 days. We often recommend different types of steroids for the same child during a flare. So we might have a really mild steroid like hydrocortisone for the face or areas where there is natural occlusion like the armpits or the groins, and then go up to a moderate potency steroid like Umivate if there's body flares. And so there's also different types of steroids like ointments and creams. So we work with the parent and the child to choose a really suitable flare treatment plan, and they know exactly what to use on which body area and the frequency of when to use products. So there's no delay in getting their child treated. And also during a flare, eczema, when it's flaring, is really angry, itchy skin. The child is not a happy child. They're not sleeping. They feel really irritable. The parents are often irritable as well because they're not sleeping either. So the quicker you get it under control, the less traumatic it is for the whole family. But also, sometimes it can be helpful to use like a sedating antihistamine like Piriton for your child at night time to reduce that itch. So the combination of emollients, steroids, and antihistamine, I often find really powerful to getting that flare under control.
Does anxiety make eczema worse?
Anxiety, any mental kind of health conditions can be closely linked to our skin health, whether you're a child or an adult. So definitely I feel anxiety can really drive a lot of those kind of chemical signals that go around the body that drive skin inflammatory cycles. We know that when we're stressed or anxious, we produce more of our stress hormone called cortisol, and that can create issues on the skin as well. So, yes, certainly anxiety can. And that's why it's important that you try and make eczema a condition that your child feels safe when you're treating it. So you're not just medicalizing it and making them feel abnormal or different to their friends, but you're explaining to them, I need to use these products to help you feel better. And in between the bad flare-ups, having a skincare routine that they can really enjoy and they feel normal like all their friends when they have their bath time.
And that's exactly what I was thinking, is if you get the routine, and it's an enjoyable, and you do make it all sound quite enjoyable. I do feel like I want to go and dose myself now.
Yes, and anything that's sensorial, so touching your child's skin is a bonding moment, but it's also really relaxing for your child as well. So I often recommend, making the bedroom really nice and cozy, having some nice music in the background, using your emollients and doing a bit of massage for your child. If they're slightly older and they're becoming independent, my daughter's 3 now, she wants to help with the moisturization part. So she's applying her emollients whilst I'm doing it too. And she feels like it's a game almost that we're playing, and she enjoys that part of her routine and doesn't see it as a medicalized traumatic moment of her day. And that's really important, I think.
And and as an adult, and I wish, maybe it's my age, but nobody used to talk about. We used to talk about putting skincare products on. They weren't care products at all because they were designed to make us burn, really. But you know
Yes.
that, I mean, moving on to sort of sun protection and things like that. If you're well into a good maintenance routine, you're then protecting yourself from the sun automatically, aren't you?
Definitely, a healthy skin barrier means you're less likely to get damaged when you move through the different seasons. So we talked, about winter can be quite problematic for eczema skin because the cold air is quite dry and your skin loses moisture with the central heating and things like that. But the summer can also be problematic for people's skin. But having a healthy skin barrier is a good start. So if you've got your skin in good condition when you move into the warmer weather, you are much less likely to get problems in the summer, and your skin barrier is going to be stronger at protecting you from all sorts of environmental aggressors, including UV rays. In the summer, we often see two types of patients. We see children whose skin gets better, their eczema gets better when it's a summer holiday. There's a combination of theories about that, and increased vitamin D production and reducing inflammation. School holidays, children are less stressed and anxious because they're having a fun time and they're not at school. There's all sorts of theories around that. But some children get worse in the summer because the hotter temperatures can dry the skin out. And when you're hotter, you sweat more. And if sweat's left on the skin for a prolonged period of time, it can be irritant, particularly if you're eczema prone or have sensitive skin. So we often do see summer months are quite tricky for parents with children with eczema because they don't know what to use. Should I be using sunscreen or not? Will it make it worse for my child if I use products? And again, I have a kind of a list of criteria I say to look for when you're choosing your sunscreen product. If you've already found a range that you love, like Child's Farm, then see what else they have in the range. But as a general rule, you want something that is hypoallergenic and fragrance-free. You want it to have a good level of protection against both UVA and UVB and be a factor 50 plus. Water resistant is a bonus because we know children love jumping in and out of water, so that can be handy too. And you want something that is going to be easy to apply. And what I mean by that is it's good to find a range that has a few different types of products that can be used at different points of the day or for different ages of children. I've got some examples here just to kind of demonstrate what I use. So in the Child's Farm sun care range, they've kind of cleverly thought of everything. So I use a sunscreen for my daughter that's factor 50, and that's quite good to apply when you're still at home. It's got lots of skincare benefits in it as well. So you've got your water and your glycerin and your kind of hydrating ingredients, your vitamin E, but you've also got your good sunscreen protection. So I put that on before we leave the house. And what I find quite helpful is when you're on the go, having a spray. Having a spray form, identical formulation pretty much, but so you're still confident in its protective abilities, but it's much easier to use a spray on the go than sit your child down and reapply the product. One thing I always say is make sure you've got a spray that you can see, because there are lots of invisible sprays out there and you can't see clearly where you've applied the product. So I like things with, that you can actually see rather than the invisible sun sprays. And there's also quite a clever roll-on in the range as well, which is quite good on the go. If you've got a child that won't sit still, you can kind of reapply the product. This is quite good for those children that are getting their independence and it has to be them that applies their product as well. This is quite good to pack in their bag, when they go to nursery or preschool. And so finding a kind of, you often need a combination of things to suit your child's skin's needs. If you've got sensitive skin, if your child's got sensitive skin or you're an adult with sensitive skin, don't buy a whole selection of products and use it for the first time when you get to your holiday destination, because your skin might react to those products. So test patching is really important, particularly with sun care products. So at least 5 days before your time that you want to start using these products, I'd recommend test patching them. And again, an area like the wrist or behind the ears can be quite a nice place to put the products. If you did react, it's not in an obvious area, but keep an eye on your child's skin, take a picture of the skin pre-application, and then 5 days after and see, does it look red, does it look inflamed, is that the right product for you? And stick with the same products over the warmer seasons, because again, chopping and changing can be irritating to your child's skin.
But also, I think if you're engaging with your child and explaining to them that they have skin that's prone to this, and it's something that you do jointly, so that the child also has ownership of and control, because as I understand it, schools can be quite funny that they won't apply products to their child for your child. So the sooner you can get your child to understand how to put a product on, when it knows that product's disappeared and needs to put some more application. That's got to be really good, hasn't it?
Definitely, and some countries do this really well. So Australia, it's a fun part of their education to learn about the importance of sunscreen and wearing it every day. And they have backpacks which promote the sunscreen, and they carry it around in their bag at school, and they reapply it, and they see it. They understand it's a fun but important part of their daily routine. So I think we need to make it a little bit less medical and a little bit more about how to look after your own skin when your parents aren't there, and how to apply it and empower them to have control over that. But if you get into good sunscreen application habits as a child, you're much better as an adult. I always see that pattern in my adult patients if they've got used to using products when they were younger.
Definitely. So I think what I've learned from this is you get into, and this actually applies to adults. Everything that we've actually said
applies to adults actually too. Yeah.
To get into that good routine, keep, if possible, the same range. Look out if you're starting to go into a flare, and hopefully you've worked out with your doctor already what that routine would be for a flare. This is what you go onto. You go onto the heavier products, and you attack it. Yeah, you attack it strongly with lots of products.
Steroids, like the firefighters of the dermatology world, they come in and they dampen down that fire, that angry red inflamed skin. So you do, yeah, absolutely.
And then don't be frightened about how much product you put on. Don't be a skinflint. Put on plenty of the product. Get your child involved as soon as possible to make it an enjoyable, that they don't come away feeling some form of stigma for themselves or stigmatized products for when they become adults.
Exactly. You've summarized it perfectly. That's exactly the message I wanted to get across today.
Well, thank you.
And get your child involved with your skincare routine as well. My daughter loves applying my moisturizer. And we made it a fun bonding thing. She looks forward to it. She goes through my drawers in the bathroom and gets the stuff out that she knows I use every day. Make skin a fun thing, because as an adult, if you've looked after your skin well as a child and you haven't had that stigma of having a medical skin disorder, you'll enjoy your skin, and look after it better.
Absolutely. Well, Anita, thank you so much for sparing the time to come and chat with us, and also a big thank you to Charles Farm once again. Thank you.
It's been my pleasure. It's been lovely to talk to you today.
Thank you.